don't shout for my friend. They are going to review for their NCLEX. They are working on their American dream. Welcome to my channel. I am Nas Bosco. I'm a professional NCLEX reviewer based here in Africa. You're going to pass through 10 NCLEX questions and feel free to write your answers down so that you can tell me your score at the end of the test. Please tell me your score in the comments section and tell me any suggestions, anything that you feel are going to help us on this community. I am here for you, and your success is my joy. Thank you. Let me come back shortly. Alright guys, let's go! So question number 1, guys. An infant has been found to be human immunodeficiency virus HIV positive. When teaching condition-specific care, which action should the nurse instruct the mother to take to minimize the child's risk for condition-related injury? Whenever they give you patients who are immunosuppressed, guys, remember the issue of infection prevention and control, hospital-acquired infections, nosocomial infections. All that is very important to put in mind. Alright guys, so how do we make sure this patient is safe and immunocompromised? Remember, yeah, so A, check the anterior fontanelle for bulging and sutures for widening each day. Is that very important? Feed the infant in an upright position with the head and chest tilted slightly back to avoid aspiration. Is it very important? Provide meticulous skin care to the infant and change the infant's diaper after each voiding or stool. Important? Feed the infant with a special nipple and burp the infant frequently to decrease the tendency to swallow air. Alright guys, those are the 4 options that we have. What is your answer? Please write your answer down. You can pause the video, read the question like 2 times, and then write your answer down. Finished? Let's go to the answer. Okay guys, the answer is C. Meticulous skin care helps protect the HIV-infected infant from secondary infections. Bulging fontanelles, feeding the infant in an upright position, and using a special nipple are unrelated to the pathology associated with HIV. Did you get it? Okay, let's go to question 2. Which advice would be appropriate for the nurse to give to a client with dumping syndrome? Guys, this is a very examinable topic. Please get time and review dumping syndrome. Just a quick review. Dumping syndrome is that condition when if the patient takes food, it goes through the stomach very quickly and enters the small intestine. So that's why it is indeed dumping. You know, food is just passing through very quickly. So get time and read this topic through. Get your review book and pass through. Alright, option A. So what advice are you going to give? Okay, so are you going to tell your patient, take a drink after every 4 to 5 bites of food at a meal? Do you take drinks? Will that help the food not to go through very fast? Okay, then eat several small meals per day of wet foods. Okay, of wet foods. So is it that wet foods are not going to go through very fast? Then option C, remain in an upright position for 30 to 60 minutes after eating. Is that a solution to dumping syndrome, remaining in upright position? Then option D, avoid foods that are concentrated carbohydrates. Is that the answer, do you think? Okay, write your answer down so that we can see what the answer is. Alright, the answer is D, and the rationale is foods that are concentrated carbohydrates should be avoided. Dumping syndrome has vasomotor, tachycardia, diaphoresis, flushing, weakness, palpitations, and anxiety, and GI symptoms, which are distension, nausea, vomiting, and diarrhea, and occurs when there is rapid entry of boluses of hyper or smaller food directly into the small intestine. So once the food is hyper or smaller, too much concentrated, it goes too directly into the small intestine. It passes through the stomach very fast. So to decrease the symptoms of dumping syndrome, a client also should eat 6 small meals per day of dry foods and should not drink fluids with meals. Avoid very hot or cold foods and lie down for 30 to 60 minutes after eating. So that makes sense. Lying down, at least the food stays there. No much effect of gravity, but staying in upright position, gravity precipitates the occurrence of that fast movement of the food boluses. Alright guys, so did you get it? A patient with a history of liver transplantation is receiving cyclosporin, prednisone, and mycophenolate. What do you know about these drugs, guys? They are immunosuppressants. Remember, patients after organ transplant are put on immunosuppressants to prevent organ rejection. Alright, so which finding is of most concern? Which finding is of most concern for a patient post-liver transplant who is now on immunosuppressants? Okay, let's see which one is going to concern you most. Gums that appear very pink and swollen. Does that concern you most? To see that the patient has gums that are swollen and they are very pink. Alright, blood glucose level of 162 milligrams per deciliter, 9 millimoles per liter. If you took that blood glucose, if you did a finger stick and you found out the blood glucose level is 9 millimoles per liter, would that concern you very much? Okay, non-tender lump above the clavicle. Non-tender lump above the clavicle. What do you know about non-tender lumps? Alright, then D is grade 1 plus pitting edema in the feet and ankles. Okay, so which of those would concern you most? This is what NCLEX wants from you. Alright, so so are you seeing this question like this? Alright guys, write down your answer and let's go to the answer right here below. Okay guys, the answer is C. And rationale, patients taking immunosuppressive medications are at increased risk for development of cancer. A non-tender swelling or lump may signify that the patient has lymphoma. The other data indicates that the patient is experiencing common side effects of the immunosuppressive medications. Focus, prioritization. Which symptom are you going to prioritize? The other tip I give you guys is that when you are reviewing your pharmacology, adverse effects are the most important for NCLEX. Adverse effects, side effects, adverse reactions, very important. The NCLEX will want that very much. Alright. Question 4. A client with Guillain-Barré syndrome, GBS, how do you even speak this? Oh God. Is to undergo plasmapheresis to remove circulating antibodies thought to be responsible for the disease. Which client care action should the nurse delegate to the experienced and licensed assistive personnel, UAP? Very examinable topic again. Actions to be delegated to the unlicensed assistive personnel, you should know. These are a must know. Actions to be delegated to a licensed practical nurse, LPN. These you should know. Actions to be delegated to a fellow RN like you and me. These ones you should also know. So which of these ones are you going to delegate to a UAP, guys? So let me see which one you are going to delegate to a UAP. Observe the access site for ecchymosis or bleeding. Instruct the client that there will be 3 or 4 treatments. Okay, are you going to tell the UAP to say that to the patient? C. Assess the access site for bruit and thrill every 2 to 4 hours. So are you going to tell the UAP to go and assess that? Guys, even not to waste your time, wherever delegation to the UAP occurs and you see that term assessment, just ignore that, guys. UAPs, LPNs, assessments are for the RN. Then weigh the client before and after the procedure. Would you tell the UAP to do that? I don't know. But as if you are telling me, don't worry, I've got this. Okay, if you've got that, write your answer down and then we see the answer. Alright guys, the answer is D. The scope of practice for an experienced UAP would include weighing clients, observing, assessing, and providing instructions, or require additional education preparations and are appropriate to the scope of practice for a professional nurse. Alright guys. Next question. Question 5. A man calls the suicide prevention hotline and states that he is going to kill himself. Which of the following questions should the nurse ask first? So someone has called you and says, I'm gonna kill myself. Which question are you going to ask them first? Okay, what has happened to cause you to want to end your life? 2. How have you planned to kill yourself? 3. When did you start to feel as though you wanted to die? 4. Do you want me to prevent you from killing yourself? Okay. Again, another hint, guys. Wherever you see a question whereby the answer will be a yes or no, just eliminate that. I will not tell you which option is that, but just write your answer down and we see the answer. Remember guys, we are in the middle of this practice test. If you are liking what I'm doing, please click that subscribe button so that you don't miss out on my next videos. Please support your boy. This is the only way you can support your boy, and I'll be so glad to see you as my new subscriber. Welcome. Alright, let's see the answer, guys. Okay guys, the answer is B. Okay, needed info: signs of suicide, symptoms of depression. The patient will appear depressed. For patients who are too much depressed, they are at high risk of suicide. Client gives away possessions, gets finances in order, has a means of carrying out the suicide, makes direct or indirect statements, leaves notes, has increased energy. And what are the predisposing factors for suicide? If you are a male like me and you are over the age of 50, the risk increases. If you are age 15 to 19, that is for teenagers, the risk for suicide increases. So do you have a teenager in your home? Please know that they are at increased risk for suicide. Poor social attachment, like you don't have a wife, you don't have a child. You don't have anyone whom you are responsible for. You don't have friends. These are guys who are at increased risk for suicide. Okay, clients with previous attempts for suicide, clients with auditory hallucinations. These are patients who hear voices telling them to kill themselves. Overwhelming or precipitating events, too many loans, too many debts, terminal disease like cancer, death or loss of a loved one, failure at school, academic problems, issues with job. Okay, so let's look at the responses then. What has happened to cause you to want to end your life does not determine immediate need for safety. Okay, how have you planned to kill yourself? This is the correct answer. It lets you prioritize interventions to assure safety. Even if you are the president of a country, guys, and then a president of another country calls you and says, we are attacking your country, the first question you would want to ask them is, so how have you planned to attack this country? This helps you to hijack the plan. Maybe they will tell you the weapons they have used, the day they are attacking, the intelligence systems. That helps you to hijack their plan. Also, this question helps us to hijack the suicide plan for our patients so that we can ensure their safety. Alright guys, so when did you start to feel as though you wanted to die? It does not determine immediate need for safety. So do you want me to prevent you from killing yourself? This question will attract a yes or no response from your client. So this is not encouraged in nursing. Alright? So guys, question 6. A client is telling the nurse about his perception of his thought patterns. Which of the following statements by the client would validate the diagnosis of schizophrenia? Please read about schizophrenia so that you cushion yourself with enough knowledge about this disease. Positive symptoms of schizophrenia, negative symptoms of schizophrenia. Understand things like hallucinations, illusions, delusions. Okay, so that you are helped a lot, so that you are not taken by surprise. Alright, option A. It's clear that this is an alien laboratory and I am in charge. Okay, so the patient feels like they are here. Maybe this is a post-mortem lab. Okay, option B. I can't get the same thoughts out of my head. So is that a patient with schizophrenia? I know I sometimes feel on top of the world and then suddenly down. Okay, so is that a patient with schizophrenia? Sometimes I look up and wonder where I am. Okay, so is that a patient with schizophrenia? So which of these verbalization will confirm that this is schizophrenia, guys? Write your answer down. Let us see the answer. Alright guys, the answer is A. The needed info is that schizophrenia is generally characterized by delusions, grandiose delusions, religious delusions, paranoid, nihilistic or delusions of reference or influence, confusions, hallucinations, and illusions, which are misinterpretations of real external stimuli. If I show the patient this cup and they tell me that is not a cup, that is a rock, okay, so that is misinterpretation of real stimuli. A cup being interpreted as a rock. Okay, so that is an illusion. Alright, it is clear that this is an alien laboratory and I am in charge. This is the correct answer. So illogical, disorganized thoughts are typical of schizophrenia. I can't get the same thoughts out of my head. That is recurrent intrusive thoughts, are characteristic of OCD, obsessive compulsive disorder. I know I sometimes feel on top of the world, then suddenly down. That is rapid changing moods are characteristic of manic phase of bipolar disorder. And then sometimes I look up and wonder where I am. That is confused disorder. Thoughts characteristic of cognitive disorder. Disorders of thought processes. Did you get that? Okay, let's go to the next question. When discussing psychosocial development with a new parent group, the nurse presents Erickson's theory and identifies which task as the psychosocial task of infancy. Guys, things like Erickson, okay, are very important for you to read, and other theorists of development. Please don't go to your NCLEX exam without passing through this knowledge. Okay, so let's see which stage of development is this. Okay, so when discussing psychosocial development with a new parent group, the nurse presents Erickson's theory and identifies which task as the psychosocial task of infancy. When you are reading your question, guys, identify your keywords. So the keywords here include psychosocial task, then infancy, okay, and then Erickson's theory. That means they are not referring to another theorist like Sigmund Freud or any other. So A, trust versus mistrust. Is this infancy? Oral versus anal. Is that infancy? Sensation versus mobilization. Is that Erickson, and is it infancy? Initiative versus guilt. Is that Erickson? Is that infancy? Okay. So, alright. Write your answer down. Write your answer down. Alright, guys, the answer is A. So in infancy, infants are in a stage of trust versus mistrust, according to Erickson, and it is the psychosocial task in infancy. Okay, I have put this in, for you to remember that in infancy, the stage is trust versus mistrust. They will trust anyone. These kids will trust anyone who meets their needs. If you don't, they're not going to trust you. Early childhood, autonomy versus shame and doubt. Preschool, initiative versus guilt. School age, industry versus inferiority. Adolescence, identity versus role confusion. Young adulthood, intimacy versus isolation. Middle adulthood, generativity versus stagnation. Maturity, ego versus despair. And yes, that's how it moves. That's how life moves on. So where are you? Where are you, my friend, in this circle? So are you in intimacy versus isolation, or you are in generativity, or you are stagnated? But if you were stagnated, you wouldn't be doing this practice test. So you are moving forward. Let's move forward to the next question. Question 8, guys. A physician prescribes an antihypertensive medication for your client. As a nurse, you would instruct the client to, so the key word here is antihypertensive medication. Okay, so you would instruct. This means a teaching that you would give to your client. So what kind of teaching would you give to your patients about antihypertensives? How simple is that? Okay, A, limit fluid intake to 1200 ml daily. Do you limit fluid intake when the patient is taking antihypertensives? Do you advise them to limit fluid intake? B, increase activities but limit foods high in magnesium. Do you minimize magnesium? Do you increase activities just because you are taking antihypertensives? Take a laxative along with the antihypertensive medication. So antihypertensive medication, do they cause constipation? I don't know. You are the guy who knows this. Change positions slowly and sit up for a few minutes before rising from a lying position. Would you tell your patient to do that? Is it necessary? Especially for patients who are on antihypertensives? I don't know. Write your answer down so that we go down to what is the right answer. Alright guys, the answer is D. I knew you would get this. I knew you got that. I knew you got that. So many of the antihypertensive medications cause orthostatic hypotension. Therefore, the nurse should instruct the client regarding sudden movements and about rising slowly to prevent a decrease in blood pressure and prevent client injury. Answers A, B, C are appropriate instructions in regards to medications for hypertension. Yes. Let's go to question 9, guys. An 11-year-old child scheduled for a diagnostic procedure will have an intravenous line inserted and will receive an intramuscular injection. Which form of communication should the nurse use in preparing the child for the procedure? What are the key words, guys? So, 11-year-old, okay, intravenous line, intramuscular injection. Which form of communication is a key word? Okay, preparing child for the procedure. Okay, so alright, so one is reassuring the child by introducing the equipment used. B, teaching the parents so that they can explain everything to the child. Telling the child not to worry because the doctors can take care of everything. Is that the answer? Using pictures, concrete words and demonstrations to describe what will happen. So is that the answer? I don't know. Write your answer down so that we go to the rationale. Alright guys, so rationale, the answer is D, and that the school-age child understands best with visual aids and concrete language. Don't use proverbs. Proverbs, idioms, those are not concrete language. Use language that is clear, concrete. Option A does not fully address the child's concerns. Option B inappropriately delegates the responsibility for teaching to the parents. Option C is not therapeutic. Alright guys, so that is the question, that's how you would go about that question. We go to the last question. If you are still here with me, please thank you. Thank you for revising with me. You encourage me to make more of these tests, and so that I can also have a purpose, I can feel useful in life, that at least I contributed to your success. Thank you so much for being here. Let's do the last question, guys, and I will. Okay guys, the last question. The nurse reviews wound care culture results and learns that an assigned client has methicillin-resistant Staphylococcus aureus (MRSA) in a wound bed. Which type of transmission-based precautions should the nurse implement for this client? So, infection control and prevention is a must know before you go to your NCLEX. Contact precautions, droplet precautions, airborne precautions. The good news is that I have a video that I have linked here in the description box for you to know how to what precautions must you put for airborne, droplet, okay, and contact. Okay, so just watch that video, you will be helped. I believe it will help you. Okay, but for MRSA, what precautions are we going to take? Alright, so are we going to take enteric precautions? Are we going to take droplet precautions? Are we going to take contact precautions? Are we going to take airborne? What precautions are you going to take? This is your last answer. Write down that answer and then we see whether you are right or wrong. Alright guys, the answer is C. The rationale is that contact precautions include standard precautions and require the use of barrier precautions such as gloves and goggles. Contact precautions are used for clients who have diarrhea, draining wounds, or methicillin-resistant infections. The goal of these precautions is to eliminate disease transmission resulting either from direct contact with the client or from indirect contact through inanimate objects or surfaces that the pathogen has contaminated, such as instruments, linens, dressing materials, or hands. Enteric precautions are initiated if the organism is transmitted via gastrointestinal tract. Droplet and airborne precautions are used if the organism is transmitted via the respiratory tract. Guys, these are some of the references I have used. You can use those books. They don't pay me in any way to advertise them, but yes, they are helping us to practice. Alright guys, so thank you so much. This is so great. This is so great. I congratulate you upon having finished this test. Congratulations. Remember to subscribe and share this practice test with your friends. Bye bye for now.